Good afternoon, and thank you for joining us for this community briefing on COVID-19. Joining me again this afternoon is interpreter Margie Propp. Thank you so much, Margie, for providing your services to make this briefing more accessible for all. We encourage everyone to visit our website at covid19.lincoln.ne.gov, where you will find a dashboard with the latest COVID-19 data. We update that dashboard at about 3 p.m. daily, and there you will also find our COVID-19 risk dial, which is a color-coded tool that helps provide an understanding of the level of risk of COVID-19 spread in our community. The dial currently points to orange, indicating a high risk of the virus spreading in Lincoln and Lancaster County. Today in Lincoln, an additional 35 individuals have tested positive for COVID-19. The total number of lab-confirmed cases now stands at 2,517. Our total recoveries identified to date are up from 817 to 869. And before Director Lopez comes forward, we want to invite you to once again join us and so many other members of our community as we take common sense steps to prevent the spread of COVID-19 and to take care of one another during this pandemic. Wear a mask. Watch your distance, keeping at least 6 feet distance between yourself and others, and wash your hands frequently. These proven public health strategies are vital to our ability to reopen schools safely and to reinvigorate our local businesses and economy. And with that, I turn it over to Director Lopez with the latest update.
Thank you, Mayor. This past Friday, we shared that for the second week, the COVID risk dial remained in the orange level, indicating a high risk of the virus spreading in the community. An increase in new positive cases continued last week. Sunday, July 12th through Saturday, July 18th, 330 new cases were reported. This was the highest number we have ever had in 1 week, more than the previous high of 299 cases the week ending May 9th. Correlated to this high number of cases was also an increase in testing, from just over 3,000 tests the previous week to just over 5,000 tests this past week, which is also the highest number of tests ever in a week's time. For the month of June, the average weekly positivity rate was below 5%. Since the beginning of July, the weekly rate has increased to around 7%. This is an example of why considering multiple data indicators is crucial for understanding what is currently happening in Lincoln. The clarifying factor when reviewing the 3 indicators I have mentioned is the positivity rate and whether it is increasing or decreasing. In Lincoln, over the past 2 weeks, we have seen an increase in testing. With this increase in testing, we have also seen an increase in new cases. This increase in the positivity rate indicates community spread has become more established. The number of COVID-19 patients hospitalized is currently 22, with 15 Lancaster County residents and 7 from other communities. Since the beginning of this pandemic, 37,952 individuals have now been tested for COVID-19 in Lancaster County. This is an unduplicated number of individuals. No repeated tests are included. As a reminder, this week Test Nebraska will be at North Star High School from 8 a.m. to noon and 1 p.m. to 6, today through Saturday. Testing is by appointment only, and begin this easy process with a free online risk assessment at testnebraska.com. The first couple of days with the face covering requirements has gone well. This has been expected because we know that the people in our community really want to do what is best to keep moving forward. Not surprisingly, our health department did receive about 70 calls yesterday, most being questions from businesses and the public about how it may affect them. There were also a handful of complaints or concerns about noncompliance. We will continue to emphasize education and support. Complaints regarding compliance can be uploaded online through Uplink, the free app hosted on C-Click-Fix platform on the city's website. Businesses with specific questions can call the health department at 441-6280. We continue to focus on education and support in wearing face coverings because they are effective at curbing transmission of the virus. Evidence demonstrates that wearing a face covering makes a difference. In addition to their scientifically proven benefits, the face coverings we wear communicate a visual reminder that we need to take other public health precautions, like keeping our 6-foot distancing from one another. They are also acts of support and care for our family, friends, classmates, teachers, neighbors, and community members. They empower each of us to be part of the solution. The Health Department's mission to protect and promote the public's health, a mission we take seriously every day, especially during a pandemic. Every year, the Health Department works with the schools to control communicable diseases. From our long-term partnership and work with the schools, we know that schools provide many supports for families and children to be healthy, including ensuring access to healthy food, physical activity, and social interaction. In other words, schools being open helps children and young people be healthier. Having schools open is also very important to our community's ability to provide health care and other essential services. If schools are not open, the availability of parents who work in healthcare, law enforcement, fire and rescue, corrections, and other essential services is widely impacted. This year, our team of nurses and epidemiologists have worked with schools to develop policies on investigating illnesses caused by COVID-19, evaluating exposures, and quarantine and isolation. These policies are based on CDC and state guidance and current scientific information on how COVID-19 is spread. We have been working closely with local school districts and how they can use the COVID risk dial to help inform them of the local risk level and use it for planning school operations. People are concerned and anxious about how schools are going to look this fall. The bottom line is schools are doing their part and doing their best to prepare for multiple scenarios and contingency plans for different levels of risk. The Health Department has been meeting with Lincoln Public Schools and other schools in Lincoln and Lancaster County and the administrators multiple times a week since mid-May. Specific guidance and strategies regarding physical distancing, engineering controls, administrative controls, and personal protective equipment have been provided for how best to safely operate schools. The context here is there is one Lancaster County COVID risk dial to assess the risk of spread in the community. However, there have been specific guidance and strategies developed for different sectors in our community. The online guidance posted with the dial information is for the general public to best protect themselves for where they are in the pandemic. However, there is also specific guidance for businesses that provide local strategies to implement protective measures based on where our community is at in the pandemic. The Health Department has been working together with Lincoln Public Schools and the other schools in our community and meeting with the administrators to provide specific guidance on how to make the school environment safer based on where we are at on the risk dial. We are confident that our school districts, especially Lincoln Public Schools, have been diligent in their planning, and the Health Department will continue to support their efforts and prepare for safer teaching and learning environments.
Thank you, Director Lopez. And as she just mentioned and explained, our health department has worked very closely with Lincoln Public Schools and other schools as they've developed their plans to hold school this fall. LPS just released the details of their pandemic plan and procedures for the 2021 school year this afternoon, and I know as a parent of an LPS child, I can't wait to dig into the hundreds of pages that they entails. Their plan, of course, relies on the COVID-19 risk dial developed by our local health experts to set expectations for students and families about what we will see as we continue to navigate the pandemic together and make every effort to support the education of youth in our community. Here to give an overview of the planning process and how those details are being communicated to stakeholders and other important details is LPS Superintendent Dr. Steve Joel.
Thank you very much, Mayor. Appreciate again the airtime to release this very important plan. I have with me today colleagues from my office that have worked all summer, as most of us have, with regard to the planning. Dr. Liz Standish, who's our Associate Superintendent for Operations, Dr. Matt Larson, Associate Superintendent for Instruction, and our Board President, Kathy Danick. So, Mayor, I could probably just lend you this 600-page plan that we have and save you some website time. But this has been anything but an ordinary summer for us, as it has for the listeners and our parents and our staff. Prior to June 16th, we were directed by the governor and the Commissioner of Education to develop a plan to reopen our schools. I think the belief back then was that as much as we felt pretty good about remote learning, we were not connecting with all the students that we needed to connect with. It was a major hardship for parents. And as you mentioned, Director Lopez, that there's a whole bunch of essential workers that we're trying to navigate how to work with their children as well as provide essential services in the community. And so we issued on June 16th then the plan that we were going to reopen schools. And from June 16th till I think this morning with our very first Zoom meeting, we've been putting the details to the plan. This has not been done in a vacuum. We have not done it in isolation. We have reached out to a lot of different voices. From June 16th through today, we've had hundreds of questions and concerns that have been raised by members of our staff, members of our families, and our community. And we've worked diligently, primarily with the Lincoln Lancaster Health Department. And thank you, Director Lopez, for the work of your staff and team and for your recognition that this is a plan that is as safe as we can make it going into the school year. And we knew that there were a lot of questions and a lot of concerns. So again, we didn't make these decisions in isolation. We didn't presume that everybody was going to look at this and say, okay, that makes a lot of sense. It's easy. There's going to be some apprehension. But we believe that this plan really addresses a lot of those concerns and a lot of those questions, and hopefully will get us back to where we can do what we're charged by the community to do, and that's provide high-quality educational services for 42,000 students. So we know this. What we know now is a lot more than what we knew in March when we made the decision to close our schools. There's so much more information. There's so much more science. There's so much more discussion. There's been research. There's been articles, and I won't pretend to have read them all. But I think at one point or another, somebody referred me to them all. And the belief right now is that schools need to be in session, that we need to develop plans to bring our students back, to bring our staff back, and we need to do it in a way that represents as safe of an environment as we can put forward. And we know that if we meet conditions such as face coverings, thank you, Mayor, for the mandate last week, and I think, as I mentioned on Friday, and I'll reiterate, that helps us a lot with what we're doing. We made the decision we were going to mandate face coverings several weeks ago. Distancing, as Director Lopez talked about, and Mayor, you've mentioned a number of times, hand washing, and then self-monitoring, because we are in an environment where the virus is active. We know that if we do that and we take care of the details, and here are the details. For example, what about passing time at high school? What about lunches? What about before and after school programs? And both Dr. Larson and Dr. Standish are going to pick a couple of broad areas where we've received the most questions, and they'll give more detail. But we have tried to, with great guidance from the health department, we've tried to address those in this plan. And we feel very, very good about that we've addressed them. So while, we felt like remote learning was okay, and I want to thank the teachers and the administrators that really really worked hard to make that work. 72 hours to transition from in-person instruction to remote learning would challenge any school district, and certainly it challenged us. But as the spring wore on toward the end of the school year, our remote learning became stronger and stronger. In fact, what we were able to do was pilot a synchronous learning environment, summer school, for about more than 1,000 students, and the results of that were very, very well. So we know now that we are much better at remote learning. However, with remote learning, we understand that we still have students that are detached. We still have students and families that are struggling. When you think about what Lincoln experienced and Nebraska and the country experienced with regard to unrest, we have concerns that our families of color still continue to struggle. And we know that when students' needs are not met in nutrition and social activity and physical activity and a sense of belonging, that a big part of who they are and how they're developing during these years that they're in school are missing. And so again, we feel compelled to create a plan that's going to bring our students back, and we want it to be as safe as possible. I want to be really clear, though, that mitigating risk is different than removing risk. We understand that this plan is not perfect, and we understand that we still have risk, but we also believe very, very strongly, again, through the help of the medical profession here in Lincoln, with the doctors that signed on the face covering request, and the work of our Board of Education and our staff and the health department. We believe that we can mitigate this risk to a point where we can conduct school in a robust way. So we collected a lot of questions. We went to the experts. People want to know, where did we get our information from? We went to the experts. The medical profession in Lincoln has been fantastic, as has the health department. Every question that we've asked with regard to guidance is in this plan, and our staff have the ability to get quite a bit deeper based on their interests in their areas. We're aligned to the risk dial, and that risk dial is subject to change, as we learned a couple of weeks ago, and probably and in likelihood could change again. This plan has to be fluid, it has to be flexible, and we need to be able to adjust. And again, we've collected hundreds of questions, and this 600 pages is really the culmination of all of that. So the plan details, we released at 2 o'clock on our website. Unfortunately, or maybe fortunately, the website crashed, and that was because of the voluminous number of interested patrons and staff that wanted to get to it. Just before starting the press conference, I was informed that it's back online, so we're there. And please, listeners and our parents, and we're going to be doing a community Zoom at 5:30 today. We've done 3 staff Zooms earlier today. Look at that document and see if it doesn't answer your questions. Again, the question we can't answer is, we cannot guarantee complete lack of risk. And we want to be clear about that. But we feel very confident that we can mitigate that risk. And parents, you've also received a link, or will receive a link, a request for remote learning. We know that not all of our students are going to be comfortable in our schools until we've got the virus, the COVID-19 virus, addressed in a very suitable fashion. And we are prepared, as I think you'll hear more detail from Dr. Larson, to offer a remote learning option that will be synchronous, which means that students will participate in class instruction via Zoom in the 5 or 6 hours that they're scheduled to be in school. It's going to be quite different students than what you may have experienced this spring, because there'll be attendance taken, there'll be grades recorded, there'll be assignments, and we expect it to be very, very close to an in-class experience. So let me summarize this and then call on Dr. Standish to address a couple of things in detail. We believe this plan mitigates but won't eliminate risk. And we know that going in. And unfortunately, we're in a point right now as a society that there's an awful lot of unknowns out there, and we're going to have to learn to live within those unknowns in the safest way possible, which is why face covering, social distancing, hand washing is all going to be important. Parents and students, when we say 100% of our students are going to be in school, what we're saying is they're going to have opportunities for school. And so we're going to open up all of our buildings, and we're going to have instructors and staff that are going to be employed in those buildings. But we also have the remote option, and we're calling remote school. So 100% of our students have access to school, and again, the remote learning option is going to have more teeth than it did before. I want to comment just for a few minutes. There are some that have called for delays. There are some that have said that until we're green or we've had 14 days of no virus, that would be a good time to open up our schools. We don't believe that we can wait. We don't believe that we don't know what that timeline is, and we know that having lost some ground this spring, we have to get back to work and narrow the whatever learning gaps were there. So we've aligned ourselves with the Health Department risk dial. We're going to continue to do so. As Director Lopez mentioned, we speak twice a week for more than an hour, and I think people would be very impressed at how detailed those questions are that are now in the plan, that I think will encourage our parents as they read through it and our staff. And then finally, let me say that we are going forward with graduation this weekend, and we're looking forward to it. And to our surprise, but to our joy, 2/3 of our students have registered to participate. And that's not, that is way above what we're hearing nationally with regard to these later graduations, but I think it demonstrates once again, Mrs. Danek, the importance of education within the Lincoln community and what an important role LPS plays in the greater Lincoln community. And I know the surrounding school districts that have worked side by side with us feel exactly the same way. So we're excited to put the plan out there. We're excited to welcome our students back, and we want people to understand that they have choice. It's either remote or it's in person. And with that, I'm going to call up Dr. Standish.
Thank you, Dr. Joel, and thank you, Mayor, for the opportunity today to speak to everyone. I have just a few highlights for the community. The first is, please understand our plan is dynamic. It best lives actually on the website. The best way to access it is on the website. It's a compilation of many documents, multiple authors, lots of work. So some people, might say there's a static plan I want to review. Well, really working through the website is the best place. That's going to be the best place for the school district to keep it up to date instead of updating multiple documents across the community. The second I would like to highlight is how we approached our work with Lincoln-Lancaster County Health Department. A great team of people came together. I cannot compliment enough our work. We would take a topic and we would spend an hour talking about the details and how do students pay for lunch and can we make that touchless and how do things move through a cafeteria or a hallway. And we were very passionate about finding every opportunity we could to meet some of the guidelines from the health department. So Director Lopez talked about engineering controls where we could change physical structures to change behavior. We have administrative controls you would see a lot of in our plan, where we're talking about keeping students in cohorts on a playground, for example. And then we have 4 key pillars we really need the community to wrap around. And the mayor and the city and the health department have been talking about these for months. And the first is self-screening. So all of us, as a part of our routine process, need to self-screen. I now keep my thermometer next to my coffee pot. It's a good way to remember to take my temperature. So that self-screen, we've developed a refrigerator magnet. We're going to send out to families with 4 questions that are going to help conduct that self-screen so that you can assess, should I go to school today? Should I go to an LPS building today? If you have a fever, we ask that you not. If you've come in close contact with someone who's positive for COVID-19, if you live with someone who's positive, we ask that you not. You seek medical care, you seek testing and follow-up. So we have resources about that on our website. The second, we've had a lot of conversation about face coverings. We are supplying district face coverings to all staff and all students. We are allowing students and staff to wear their own face covering as long as it is a multi-layer face covering. So face coverings will be part of our culture. We'll all be figuring out what our favorite face coverings are to wear all day, and we'll be working through that together. Hand hygiene, Dr. Joel touched on. That's also part of the mayor's message. There will be ample cleaning product, hand sanitizer, and those type of things in the school setting. We'll be focusing on the transitions when you transition to a new space. Just like all of us have now focused on transitions. We go to the store, we use some hand sanitizer, we get in our car, we get home, we wash our hands. The school setting will be very familiar for those transitions for hand hygiene. And then finally, physical distancing. Some of the best conversations we had with the health department was really about these other strategies can wrap around that physical distancing. We know and acknowledge that physical distancing is not always possible in the school setting. We're going to encourage students to give each other space when they can, where they can, and really rely on the face covering, the hand hygiene, and the symptom screening as some of our key tools. So Lincoln, we can all come together. We can work to have school open and productive and thriving for students. And we need you to wrap around those 4 pillars as a community to help us keep schools open. And with that, I'll turn it over to Dr. Matt Larson, our Assistant Superintendent for Instruction, and he'll talk about how instruction will line up to the risk dial.
Thank you, Dr. Standish. Thank you, Mayor. As has been already pointed out, our instructional plan is aligned with the Lincoln-Lancaster County Health Department risk dial. If we are in green, it'll be school pretty much as normal, pre-K through grade 12. If we're in the red zone, then we will go to 100% remote learning. As Dr. Joel mentioned, that remote learning will look significantly different than it did last spring. At the elementary level, we'll have set schedules all across the district. At particular times, students at home will Zoom in to their classroom teacher and receive direct instruction from that classroom teacher. At the secondary level, middle school and high school, there will also be set schedules. Students will be expected to Zoom in daily to their class schedule with their classroom teachers. Attendance will be taken, homework will be done, grading will proceed as normal. It will just be very robust remote learning from home. If we're in the yellow and orange zones, we still plan to have schools in place for students to come in person. However, we will give parents the option. That's what I want to emphasize about this plan. This plan is not only flexible, it provides options for families in our community, and it is robust in that it can change very quickly if the risk dial changes. So parents have that option to remote into the classroom if we're in yellow or orange, or to send their children to school in person. This afternoon, parents are going to receive an email from the school district. It'll have a link in it to select that remote end option. Again, students will be expected to attend class daily if they choose the Zoom in. So it'll be school as normal. You'll be able to observe your classroom teacher do instruction in the classroom. If the orange dial were to go into deep orange or approach the red zone, then we may reduce the student population at the high school level. That decision would be made in collaboration with the Lincoln-Lancaster County Health Department. If that happens, we will split the high schools by alpha. A through K will attend in Group A, and L through Z will attend in Group B. One group will attend every Monday and Tuesday. A second group will attend every Thursday, Friday, and every other week the group will attend on Wednesday. We call this the 3-2 plan, but it's different from some 3-2 plans. In our plan, what will happen is when the students are at home, they will Zoom in to their classroom teacher, so they will be in school, in some sense, receiving instruction every day of the week so that we can maintain our high expectations and make sure that students do not fall behind in their learning. Again, I too would like to thank the Lincoln-Lancaster County Health Department. It's been great to work with as we've developed this plan to help ensure the safety of our students and staff members and to ensure that our families of our community have options for school to continue this year. So thank you.
Thank you, Drs. Larson and Standish. Before we take questions from the media, I'd like to call up President Danek and have her make a few comments.
Thank you, Dr. Joel. On behalf of the Board of Education, I want to take a moment to just say thank you to the hundreds of individuals who literally took their entire summer to develop a plan that creates safer learning environments for our children and their staff. Additionally, I want to thank the mayor for allowing us to come here each week and talk to our parents, our families, and our staff about what is going on in our community with the pandemic planning. The Board of Education strongly believes children learn best when they have a relationship with a classroom teacher. And each and every one of you out there knows what your school is like. I'm asking you to review the plan, sign up today at 5:30 for the presentation on LPS Facebook page, and above all, keep calm, be patient, and encourage your children to learn in a strong environment where they're supported by their family and the educators in their school. Thank you so much to Dr. Joel, Dr. Standish, and Dr. Larson for leading our team in getting this plan in place. And thank you to Lincoln Public Schools, men and women who put their hearts and souls into this plan.
If we have a few minutes, we'll take some questions. And Mayor, do you want to, I'm happy to step, okay. Okay, thank you.
Thank you to everyone at LPS. LPS is such a strength of our community, and we have so appreciated the ability to work together to help navigate the challenges of this pandemic, and the services you provide to our families are crucial. Thank you so much for your dedication. Moving on to just quick city operations update before we go to Q&A. I just want to mention that, of course, when the pandemic first began and we closed many of the public service counters in city departments to protect our staff and the public, back before plexiglass was really familiar and easy access to it, and before we had as much access to PPE. Now we're in a different place. We have those plexiglass barriers. We are able to reopen many of our counters. The planning department of Lincoln and Lancaster County is now open to the public by appointment. The public may call 441-7491 to schedule an appointment with our planning department. Our building and safety public counter is also open by appointment, and the public may call 441-7882 to schedule an appointment with building and safety. The public counter at the City Finance Department is open, and the City County Health Department is continuing to offer their services by appointment, and those appointments can be made by calling the Health Department's main line at 441-8000. Our water system, Lincoln Water System public billing counters are now open, and this includes our counter here at City Hall. And for all the latest information on city departments, you can go to our COVID-19 website and look at the city and county services page. Again, that's covid19.lincoln.ne.gov. We also had previously limited our StarTran bus service since the pandemic began, and we want to remind everyone that that bus service, including the trolley, will resume full normal operations this Thursday. And we know that creating a sustainable Lincoln is important to the short-term and long-term success of our city, and so access to transit is also vital to connecting many of us to jobs, to the stores, to food, to education and medical services. LTU has been routinely disinfecting our public transit buses and has installed plexiglass protections for our drivers. At this time, LTU Director Liz Elliott will share more about how our bus service will operate in ways that prevent the spread of the virus and help people get where they need to go safely and smoothly. Over to you, Liz.
Thank you, Mayor. Over the last 2 weeks, we have averaged about 1,500 riders per day with StarTran's limited service. Before the pandemic, we saw more than 4,000 riders per day in the summer months. So we know there is a need for StarTran to resume regular service. Throughout the pandemic, StarTran has increased routine cleaning of its buses currently in option. As you see in this video, StarTran team members have worked hard to prepare all buses for this service change. It took about 1 month to clean and disinfect the buses and install the plexiglass that will protect our drivers and our patrons. They have deep cleaned and disinfected all buses that were sitting in storage. This includes disinfecting handrails, seats, windows, and all other common places people may use or touch on the buses. We are so proud of our team members who have been essential to keeping StarTrans services open through these challenging times and who have participated in the cleaning. We can't thank them enough for their commitment to this city. We want to thank our riders for wearing masks to help prevent the transmission of COVID-19, and for their patience and understanding of the changes in our bus service through this pandemic. For the riders who don't have masks, StarTran has 1,500 masks that will be available for our teammates and riders to keep and wear to help prevent the spread of COVID-19. All riders will be able to board the front and the back of the buses beginning on Thursday. When regular service resumes on Thursday, we will continue to not collect fares until further notice. Our on-demand van service will continue to offer its services for individuals who are more at risk and need to social distance. This service has assisted more than 1,000 riders since April. StarTran bus service plays an important role in speeding our economic recovery through job access and infrastructure improvements. Before I turn this back over to Mayor, I want to invite the public to join me for a presentation on LTU sustainability efforts as part of the virtual Lincoln Electric System Sustainable Living Festival at 10 a.m. on Thursday. I'll be discussing our electric bus system and our recycling efforts. We'll also have a representative from Bike Link talking about the program at the festival as well. The virtual event is going on all this week. You can find out more at les.com/fest. Thank you.
And just to conclude the briefing, we want to share some other art from children. This is another Sunshine Tuesday. We've been connecting artwork from children submitted as part of our Sunshine Kids for Seniors project with seniors who are homebound. If your family would like to participate in this wonderful program, please do send in your artwork to sunshinekids@lincoln.ne.gov, just using first names of the artists, and we will connect those pieces of art to people who would very much appreciate their positive message. And with that, we'd be happy to open this up for Q&A on the subject of schools, transportation, and any other subject with questions from the media.
Riley from the Journal Star here.
Hey, Riley.
Hi, I have a question about, I'll go with StarTran first. Are masks required for riders to board under the DHM? Certainly they're encouraged, it sounds like.
Hi, Riley. We will be encouraging all riders to ride it. If they do not have a face covering when they board the bus, we will offer them a face covering. However, if they do refuse, they can still ride the bus. They will not be refused service on the bus.
Thank you. My second question was for Director Lopez, and forgive me if this was covered earlier in the briefing. There's some audio issues, but could she address the hospitalization rates today and sort of the availability of ICU beds?
Good afternoon, Riley. The hospital availability today, let me grab something here. So I'll just give you what we had late yesterday, because I can give our percentages off that. I didn't include the other percentages in my remarks today. But we had 27 individuals hospitalized due to COVID-19. And of those, 19 were Lancaster County residents, and one was on a ventilator. So we had that amount that we had 43% of our hospital beds available, 53% of our ICU beds, and 90% of our ventilators available.
Thank you.
Questions from the media?
Mayor, this is Bill with 1011.
Hi, Bill.
Yeah, I think the most common question we are getting is probably about the COVID-19 risk dial and the process that goes into whether or not to make changes every Friday. For now, it's been a lot of guidance, but with LPS using it, it carries a lot more weight. Is there any thoughts on being maybe a little bit more transparent with how those decisions are made, who is directly making those decisions, and whether there are any specific thresholds for when to adjust the dial or not?
Sure. We are happy to be transparent about how we're using the risk dial. I'll bring Director Lopez back up here, but it's our EPI team, along with leaders in the health department, who look at the indicators that we discuss in each of these briefings, and they assess the trends and the direction they're moving, and then they make a decision about which direction the dial is moving. But I'll let Director Lopez address your specific questions.
Hi, Bill. I think every Friday we report on the factors that we use to look at the risk dial, those measures. So one I just spoke to about with Riley, and those are the availability in our healthcare system to take care of individuals. We look at the positivity rate, which we report regularly every time we speak, and we monitor that over a 3 weeks period of time and where that's at. We look at the rolling average of our cases, which we report, which like today I was sharing that at the end of last week, we were up to our highest level on our week reporting that we've ever been at. So the case count, our positivity rate, the availability of the healthcare system. We look at what's happening with our contact tracing. When we receive positive cases, are we able to work with them within 24 hours? That's a measure. That's all data-driven that we collect on all of these things. And we look at testing availability. So that's why we're always reporting to you about what's available for tests is one component of that. And the other is to make sure that people in our community know that testing is available. So there are actual factors that we're reporting and sharing with you about the risk dial.
I appreciate all that information, Pat. Is there any thought on moving to more than once a week to evaluating the risk dial, or will you stick with those Friday updates?
Well, with the Friday updates, because like I was talking, we don't just look at one point in time. We're looking at an average over a period of time. That's from the epidemiological perspective and data perspective. That's what we is going to give us the best possible information and guidance for our community.
Thank you so much.
And just to fill out a little more information on that, Bill, for example, when we moved the dial to orange last week, a big part of that is that the positivity rate is growing. And while we expect our case counts to go up as more testing is done, that positivity rate is a really early indicator of the status of community spread. In the last 3 weeks of June, our weekly average positivity rate was 4.4%. And then the average weekly positivity rate for the first 3 weeks of July was 6.9%. That's a 57% increase in the positivity rate between those two time periods. That rang alarm bells for us because that increasing positivity rate is a red flag that this is spreading in our community and that we need to get on top of it. And because Pat mentioned that there is a lag between sort of when people first notice their symptoms, when they get tested, when those test results come back, and then when we can actually do the contact tracing, We know that we lose valuable time. We don't want to wait until hospitals are overflowing and maxed capacity. Then it's really very difficult to get on top of a surging caseload. And with school starting in the next 3 weeks, we need to be out in front. We need to be getting on top of our cases. We don't want to be like other communities, and we have the benefit of their experience to draw upon. We can learn from what we see across our country, and we can try to avoid the same fate. And that's why we care so much. That's why we're paying attention to so many indicators, not just one.
Thank you, Mayor.
Any other questions? Okay, we got one.
I have a question for an LPS representative about AFR wants to know how will LPS ensure that all students have internet available for remote learning?
Thank you for that question. As we did last spring, we will provide hotspots to families who do not have internet access and who qualify for free or reduced lunch. So we will ensure that every member of this community that needs internet access has it if they choose to take advantage of our remote learning options.
Any other questions? All right. Thank you so much for tuning in. Please check out the latest information on the LPS website about their plan to reopen schools. And please tune in again on Friday at 3:30 when we'll have the latest update on COVID-19. Take good care. Stay healthy.